Thank you so much for joining us today. My name is Martin Coward, and I am an independent Medicare insurance representative, which means that I'm licensed with a number of carriers, and I can help you learn about Medicare insurance and help you find the right Medicare insurance plan for you without being biased toward a particular carrier. And today we want to just uh, and I got in this business about 3 years ago, 4 years ago, when I was approaching Medicare age myself. And I've been in the insurance business for years, and I realized just how complicated it was. And if it's just complicated for me as an insurance person, I can't imagine what it would be like for just a regular person who's entering into this arena. So I decided to get certified and understand it better, and so I could teach it to others. And I'm really glad I did. It's probably one of the most fulfilling types of insurance that I sell because everybody pays for it, everybody needs it, and it's just darn complicated. And it doesn't need to be. The good news is it's complicated because it's got so many options and benefits and complexities that you can really you have the opportunity to really custom make a healthcare plan that is really powerful and can support you in so many ways, all your ways really, with your healthcare needs. And with some of these Medicare Advantage plans, they have a lot of extra benefits, and you could get this at really very reasonable cost. And that's what I want to go over with you today. The first thing I wanted to say to you is that you're probably getting bombarded with uh, television ads and uh, television ads, and your mailbox is flooded with all kind of brochures. All the carriers are out trying to convince you to buy their plan. What I want to tell you is that all the plan, I represent 10 carriers and they're all really good. And what really drives the bus is your personal Medicare profile. And before I get started, I want to ask, and there's a Q&A area. And if you've got a question, just to start with, that you want me to make sure we cover, you can go ahead and put it in now, or you can put it in the chat box, in the question and answer box anytime that you like. There's a way to raise your hand. You can raise your hand anytime. And I've turned on I think everybody's ability to speak. Although you may be muted now. I am going to turn on the uh, what happened to that here? I don't know where that went. Something happened to my screen. Hold, bear with me. Okay. I don't want to share my screen. So I'm going to turn on the ability for you guys to turn your microphones and you can ask me questions. I want it to be as interactive as possible. And if you got questions, the meat of this are the reason I do it live is because it is personal. You don't need to tell me anything personal about your health history right now. But if you got questions about your particular needs, you can certainly put them in the chat box and we can talk about them. The first part of this webinar is going to be me showing you a short 15-minute video that's got all the basics. It's a little dated. I apologize for that. I've asked for a new one, and they said they promised me one a month ago, and I haven't gotten it. But all the real information, none of the real important information is any different than it was 4 years ago. But there are some statistics and some numbers that are a little out of date. And as you know, the donut hole did not go away in 2020 because of changes to Obamacare. But um, mostly it's pretty accurate. And if anything is not true, I will be glad to, not clearly still true, I'll point it out to you. But it's a great, very simple, easy to follow video to help you understand the basics of Medicare. The ABCDs of Medicare is what it's called. And what I encourage you to do is just, you don't need to take notes because you can get the replay of this and watch the whole thing all over again if you want to. But, and I welcome you to do that. But um, what I do encourage you to do is to write down anything that resonates with you, or creates a question for you, because that's the whole point. Is I want to give you enough information to know how to ask the right questions. You may be already on Medicare, and you might be watching this because you want to have a review and see if it's still the right plan for you. And why would you want to do an annual review? And we can talk about that. But first, let's watch the video to give you the basics understanding of how Medicare works. Then we'll come back and we'll dig a little deeper into some of the details and answer your questions. Does that sound pretty good? Okay, let me get this thing going here. Bear with me on some of these technical things. Share screen.
Hello, and welcome again. Thanks for joining us today for a Medicare meeting. We're here to help you learn more about your Medicare coverage options and ready to walk you through the ABCDs of Medicare. These are the parts of Medicare that will help you put together the right coverage for your own personal health needs and budget. Your host today is a licensed independent broker and is well prepared to answer your questions or provide you with more information on your Medicare options. Let's get started by answering a few important questions. First of all, what is Medicare and who is eligible for it? Medicare is our country's health insurance program for older adults or those with certain disabilities. You are eligible for Original Medicare if you are a U.S. citizen or a permanent legal resident for at least 5 years and age 65 or older and eligible for Social Security, or younger than 65 and have certain disabilities, such as end-stage renal disease. When can you enroll in Original Medicare or other Medicare options? Medicare's enrollment periods include the initial enrollment period when you can sign up for Medicare during a 7-month period that begins 3 months before the month you turn 65. It also includes the month you turn 65 and ends 3 months after the month you turn 65. Next, there's an open annual enrollment period, which happens each year from October 15th to December 7th, when anyone with Medicare can join or switch plans. If you enroll during open annual enrollment, your coverage will begin on January 1st, as long as the plan gets your request by December 7th. Another option is the open enrollment period. Between January 1st and March 31st, Medicare Advantage members may make one switch to a like plan or return to Original Medicare, but may not add or remove Part D drug coverage during this time. And finally, there's the special election period for people whose special circumstances allow them to enroll in a plan outside of the other enrollment periods. You can enroll in a plan during the special election period if you retire or lose your employer coverage, move outside of the plan's service area, receive state assistance, have qualifying disabilities or chronic health conditions. So, what are the ABCDs of Medicare? Once you qualify for Medicare, you have options to consider. These are Medicare's ABCDs. Let's call them your Medicare building blocks. You can put the blocks together in a way that's right for your healthcare needs and your budget. Part A and Part B are the foundation building blocks. They are often called Original Medicare. Medicare Part A helps cover hospitalization expenses. Medicare Part B helps cover medical expenses, like doctor's visits and outpatient care. Part C is called Medicare Advantage. The Part C block always includes Part A and Part B benefits, but it may also include extra benefits that you wouldn't typically have with Original Medicare. For example, it may also include Medicare Part D prescription drug coverage right in the same plan. Part D, of course, is Medicare prescription drug coverage. This helps you cover the cost of your medications. And finally, there's a block without a letter. It's called Medicare Supplement Insurance. This policy can help fill coverage gaps and pay for things such as co-payments, co-insurance, and deductibles not covered by Original Medicare. Many people have this extra coverage, but it can be quite expensive. Here's something to keep in mind. If you don't sign up for Medicare Part B when you are first eligible, or if you drop it and get it again later, you may have to pay a late enrollment penalty for as long as you have Medicare. Your monthly premium for Part B may go up 10% for each full 12-month period that you could have had Part B, but didn't sign up for it. So, let's see how you can put these blocks together to build the coverage that's right for you. First, you can choose Part A and Part B, or Original Medicare, as it's often called. You'll have your choice of doctors, hospitals, and other providers that accept Medicare. But what about your costs? For Part A, you'll pay a deductible if hospitalized. That's currently $1,316 per benefit period. For Part B, you'll pay a monthly premium of $134 for most people, as well as a deductible of $183 per year. Once you meet your deductible, Medicare pays its share, typically 80%, and you pay the remainder, typically 20%. One thing to keep in mind is that there's no cap or limit on what you could be responsible for paying out of pocket each year when you choose only Original Medicare, or Part A and Part B. What about your medications? If you want prescription drug coverage, you'll need to join a separate Medicare Part D drug plan with a separate monthly plan premium. And if you want extra coverage to help pay some of your copays, coinsurance, and deductibles, you may want to buy Medicare supplement insurance from a private company. That's another separate policy with separate monthly premiums. Plus, it doesn't include your prescription drug coverage, which means you would need to add a Medicare Part D plan with a separate monthly premium. It all starts to add up, but you have another option. You could choose a Medicare Advantage or Part C plan, such as HMO or PPO. Remember, Medicare Part C includes Part A, hospital, and Part B, medical. It often includes Part D drugs, too. Plus, extra benefits or services not covered by Original Medicare, such as vision or dental services. In most plans, you'll use the plan's doctors, hospitals, and other providers, or you may pay more or all of the cost. You may pay a monthly premium for your Medicare Advantage coverage, in addition to your Part B monthly premium, which you continue to pay. Many plans have low monthly premiums. You'll have copayments or coinsurance for all your covered services, which vary by plan. There are other advantages of Medicare Advantage plans. They are offered only by private insurance companies that have contracts with Medicare to provide these services. There's a yearly limit on what you could pay out of pocket, so you're protected in the event that you have a significant health situation and expense. And you avoid the added cost of a Medicare supplement plan. Think of Medicare Advantage as all-in-one Medicare coverage. So you can see, there are different ways to get your Medicare coverage. Use your Medicare building blocks to get the coverage that fits your healthcare needs and budget. This is quite important, so let's review it again. You can choose Original Medicare, Part A and Part B, and stop there. Or you can add a Medicare Part D prescription drug plan for an additional monthly premium, and maybe even a Medicare supplement policy to cover gaps in expenses not covered by Original Medicare. Medicare supplement policies can cost $200 to $300 per month, or $2,400 to $3,600 a year upfront, meaning you pay this additional monthly premium regardless of whether you need the added coverage. Or you can choose an all-in-one Medicare Advantage plan, or Part C, that rolls together Medicare Part A and Part B, and usually Part D, drug coverage, plus additional benefits and services, which vary by plan, into a comprehensive all-in-one Medicare plan. The plan comes with a yearly limit on what you could pay out of pocket. Many Medicare Advantage plans have $0 or low monthly premiums, and you will not need a Medicare supplement when you select a Medicare Advantage plan. Not surprisingly, with all these advantages, Medicare Advantage is growing in popularity. Enrollment in Medicare Advantage has increased 33% from 2010 to 2017. It now accounts for 19 million people in the U.S. Almost one-third of all people with Medicare choose Medicare Advantage. Of those people enrolled in Medicare Advantage, 90% are satisfied with their plans, 94% are satisfied with the quality of care they receive, and 90% are satisfied with the benefits received in their Medicare Advantage plan. So what are the top reasons people choose Medicare Advantage plans? Coverage. Medicare Advantage plans typically offer more benefits than original Medicare. Plus, they often include Part D coverage, so you have all the coverage you need in one plan. Cost. The costs of monthly premiums, deductibles, and copays may also be more affordable than other options. Remember, there's a limit on yearly out-of-pocket expenses, so your wallet is protected. Convenience. Medicare Advantage plans offer all-in-one convenience for your medical, hospital, and depending upon the plan you select, drug benefits in one plan. Care. Medicare Advantage plans collaborate closely with your doctors, nurses, and specialists to make sure you get the care you need when you need it. Let's make sure that you understand the basics of Medicare Part D prescription drug plans, too. This information pertains to both standalone Medicare Part D plans as well as Medicare Advantage prescription drug plans, often called MAPD plans. How much will you pay for Part D coverage? Your drug plan costs will vary depending on the plan you choose and the monthly premium and cost-sharing amounts required. Your prescriptions and whether they're on the plan's formulary, which pharmacy you use, whether it offers preferred or standard cost sharing, is out-of-network or mail order, whether you're enrolled in a program to help cover your Part D costs. This is important to know. You may have to pay a late enrollment penalty if you don't join a Medicare prescription drug plan when you're first eligible and you decide to join later. The cost of the late enrollment penalty depends on how long you went without what's called credible prescription drug coverage. This is prescription drug coverage, for example, from an employer or union that is at least as good as Medicare prescription drug coverage. Most Part D drug plans charge a monthly plan premium. You pay this in addition to your Part B premium. If you're in a Medicare Advantage plan with Part D drug coverage, your monthly Medicare Advantage premium already includes your Part D premium. Your Part D coverage has 4 stages each year, and your costs vary from stage to stage. Stage 1 is your yearly deductible. This is the amount you must pay before your plan begins to pay its share of your covered drugs. Some drug plans don't have a deductible. Be sure to check this. Stage 2 is the initial coverage stage. You pay only your copayment or coinsurance for your drugs. Stage 3 is known as the coverage gap. After the total amount of your drugs paid by both you and the plan reach $3,750, you enter the coverage gap or donut hole. You have to pay for your drugs until your total drug costs reach $5,000. The good news is that the Affordable Care Act shrinks the donut hole little by little each year, until it is eliminated entirely in 2020. Stage 4 is called catastrophic coverage. If your total drug costs are higher than $5,000 for the year, you enter the catastrophic coverage phase. In this stage, you pay a small copayment or coinsurance for your drugs for the rest of the calendar year. You should also know about drug formularies and tiers. A formulary is just another name for the list of brand names and generic drugs covered by a plan. Be sure to check the formulary for any plan that you're considering to be sure your medications are covered. And drug tiers are just a way of organizing a formulary's covered drugs into smaller groups, or tiers. Drugs in each tier have a different cost. For example, a drug in a lower tier will generally cost you less than a drug in a higher tier. Some covered drugs have additional requirements or limits on coverage. If you or your prescriber believe that a coverage rule should be waived, you can ask for an exception. The types of coverage rules a plan may have include prior authorizations. This means that you or your prescriber must contact the drug plan before you can fill certain prescriptions. Your prescriber may need to show that the drug is medically necessary for the plan to cover it. Quantity limits. These are limits on how much medication you can get at one time, and step therapy. In some cases, you must try one or more similar, lower-cost drugs before the plan will cover the prescribed drug. Finally, people with Medicare have rights and protections which are good to know about. You have the right to ask the plan to provide or pay for items or services you think should be covered, provided, or continued. This is called an organization determination. You have the right to request a review of certain decisions about healthcare payment, coverage of services, or prescription drug coverage. This is called an appeal. You have the right to file a complaint, including complaints about the quality of a plan's care. This is called a grievance. Medicare Part D and Medicare Advantage plans are required to have appeals and grievance procedures. They are designed to protect you. Your rights and protections are explained to you in the Evidence of Coverage document for your plan. The Member Service Department at your plan also can help explain them. Now that you understand your Medicare options and know how Medicare Advantage plans work, how do you know if you're enrolling in the right plan for your situation? Talk to your doctor. Your doctor will know which plans are easy to work with and do the right things for their members. Talk to an expert. Licensed agents like ours work in your local community and are specially trained to help people like you understand your Medicare choices. It's their job to help you find the right coverage. Finally, look at Medicare star ratings. Medicare evaluates plans based on a 5-star rating system on things from member satisfaction to how well they keep their members healthy. The more stars a plan has, the better it has scored in those categories. Look for a plan with higher star ratings. Before we wrap up and turn the program back over to your host, let's review what we've covered. So far, we've discussed the ABCDs of Medicare. Remember, our Medicare building blocks and the various ways that you can put these blocks together to build the coverage that's right for you. Medicare Advantage and why this relatively new option is gaining popularity. Medicare Prescription Drug Plan Basics, and Medicare Rights and Protections. We also talked about when you can enroll in Original Medicare or other Medicare options. You can do this during the initial enrollment period when you turn 65, or during the open enrollment period each year from October 15th through December 7th. You can also enroll or make changes during a special election period if you qualify. Thank you again for attending our Medicare meeting today.
Okay. Anybody got questions? I'm going to turn on the microphones so you can speak. Just unmute your phone.
Okay.
Okay.
Yes, I have a question.
Sure.
I was on disability. I still am on disability. I've been on it for a number of years because I had 2 strokes and I have diabetes.
Uh-huh.
Now, they took me off, I guess, of Part D.
Go ahead.
Prescriptions are covered. They just don't cover my insulin. And I realized that they took me off because they said that I'm because of my Social Security now that I make too much money, and they were charging me $140 a month for something. I don't know, but they took $140 out of my disability money, and they took away Part D, I think, for my insurance. And I'm wanting to get back on, I guess, if I can, back on Part D. But I need what I really need is my insulin covered.
Okay. Well, there are certainly plans that will cover your insulin. Let me ask you this question. Are you Medicare age eligible? You said you were on disability.
I'm 68 now. And yes, I'm still on disability. And I've been on since like 1990 or 95.
Okay. So currently, what do you currently have? Do you currently just have original Medicare A and B, and you had a standalone prescription drug plan?
Yes, I believe so. I have had A and B. When I first started and I applied for everything, they had me on, I guess, A, B, and D because I paid no out of pocket except for a couple dollars for some of my prescriptions.
Okay. This I'm just trying to get. I'm just trying to guess. Have you ever been? Are you? You're on Social Security, but you're not on Medicaid, right?
Medicaid, just a second. Honey, am I on Medicaid? I don't think so. I don't think I'm on Medicaid.
Okay, because if you
When I started out, they had me on what they called Medicare, Medi-Cal, I think.
are you in California?
Yes, sir.
Okay, so that is a dual Medicare Medicaid plan, and it sounds like to me that they took you off of Medicaid. The only reason you'd come off Medicaid is or Medi-Cal is on the state you're in. You're in California. Medi-Cal is like Medicaid, and it's based on your income. So when you were, I guess you were disabled, so your income was low, and you qualified for Medicaid.
Correct.
Something must have happened that disqualified, and when you're on Medicaid, then all your prescription drugs are covered through Medicaid. That's what that is.
Right. Okay.
Well, what it sounds like happened was you got to a place where your income got high enough where you no longer qualified for Medi-Cal.
Yeah, it was my Social Security that kicked in.
Then what you needed to do was you needed to apply for Medicare Part D as a private standalone policy.
Okay.
When did how long has it been since you've been off of Medi-Cal?
It's been a few years since they did this to me. And I've been trying to do whatever I can to help with the cost of my insulin. And I'm not getting anywhere with it. They keep telling me, well, try this and do that. And
okay.
I've tried everything and it's not helping.
All right. Well, listen, let me make a suggestion for you. And I'm going to give this to anybody that wants it. It's the best way for me for us to do is to schedule a one-on-one, you and I don't necessarily want to scarce your personal
right. I understand
group. But I would like to offer some, and I don't charge this. This is part of what I do, is to schedule a one-on-one Zoom meeting when we can see each other, we can have a real conversation, and I will look at your medical profile and we'll see what options are available for you. Because
that sounds perfect.
Need is one. What you might want to do, and it also is to see if you could become eligible for Medicaid again. I don't know what your income is, but that's one option. But what we need to do is we need to find you, and you're California's got great programs. We can easily find you a Medicare Advantage plan that will cover your insulin, all your diabetes drugs for nothing, really. They've got great plans in that area.
Okay.
And cover all your other prescription drug plans. And we can probably find you one at zero premium to low cost.
Okay, good. That sounds good. The only other thing that I'm having problems with is they have me on an HMO, which I guess is nice, but I think I was on a PPO before because I didn't have to ask permission to go see a doctor. If there were specialists or doctors that I needed to see, I looked them up, or by word of mouth, I found them, and I could just go to them. Now they want me to go through a personal care physician and get him to sign things to say to go back to my HMO and refer me to doctors. And it's nice, better than nothing, but it's a pain because I don't get to see some of the doctors that I used to.
So that's another thing we can certainly take into consideration. You don't have to go with a PPO. There are certainly plans at an HMO. You can go with an HMO or a PPO. and often you can get a PPO with the same cost as an HMO. I personally prefer PPOs for the same reason you're talking about. I have a PPO personally because I don't want
Right.
to do that hassle of having to get a referral. And it also depends on the area, and sometimes HMOs don't require that. It depends on the carrier. So it all depends on the best way to do this, and because your questions are really good, and I can certainly help you get, but we need to find you a plan that best meets all your questions. You want a PPO, sounds like in California, that allows you to see the doctors you want to see, pays for all your diabetic supplies and prescription drug coverage. Is that right? It's low a
Yes.
cost as possible.
Yes.
Okay, so I'm going to give you a link in a second, and you can go and you can, or I can just sign you up. You give me your email address, I can go ahead and sign you up. Let me put on the screen real quick my email address. Just hold on a second.
Well, I think I received an email from you telling me about this. So I have the email address if I could use that.
Yeah, that and you, there's a link there that will take you. If you send me an email, we'll get you signed up for a review, a Zoom. You and I just on the phone together, trying to find you the right plan. Does that sound like a good idea?
Thank you. That would be great.
Yeah, that's really what I. That's the whole purpose of doing this, is for you to get us to get to know each other, to know there's somebody out there that can help you find what's right for you. And that's the whole reason why I do this, because people just like you, they need answers, and I'm happy to do that. So we'll make sure that that happens. Okay.
Okay. Thank you.
Yeah. Anybody else got any questions out there?
Hmm.
Anybody, if you prefer, you can always raise your hand, or there's a Q&A box. You can always type your questions in the Q&A box if you have other questions. I have a question. If you would raise your hand if you are already on Medicare. Okay. Raise your hand if you'll be eligible for Medicare in the next 6 months. Okay, so we got two people. One, Rick, it looks like you're already on Medicare. And Sanja, you'll be up in about 3 or 4 months, okay? And we know what Richard's story is. Lori, are you up for Medicare anytime soon? Okay. Um, do you have anybody have any questions? If you already have Medicare, let me just make one other. Let me talk to those of you who currently have Medicare. Right now, we're in something called the annual. I will turn 65 and okay, perfect. Give me 1 second, Lori, and I'll talk to you, because now is a perfect time for us to meet, and for us to find you a plan so that you're ready to go as of January 1st. So you're aging in on January the 1st. So I'll address that in 1 second. But for now, if you're already on a plan, we're in what's known right now, as you saw from the video, we're in something called the annual enrollment period. And I recommend, I do with all my current clients, to always do an annual Medicare insurance review to make sure that the plan you have right now is the best plan going into the new year. And the reason to do that is for two reasons. One, your needs may change. And two, the plans change. Every single year, they make changes to the plan. And every carrier makes changes because they want to be competitive. So the plan you put in place in 2020 that you currently have may very well be the very best plan for you in 2020, but with the changes coming up in 2021, you might want to make some changes. So what we do in an annual review is we look at your currently plan, we run it through the system to see what plans offer, And if there's a plan out there that's offering you more benefits at less money, we'll take a look at that. And if it makes sense to you, then you change. If it doesn't make sense, there's no reason to change something that's working. I don't see. But I think it's good. It's good practice, if you will, to review your plan every year with an independent like me, because I'm not going to try to get you to go to United or Scan or anybody else. I don't. It doesn't matter to me. I'm licensed with all of them, and my job is to make sure you're happy with the plan you have and it's the right for you. So you'll come back and stay with me, and I can help you out from year after year after year. Because what happens also is that things come up during the year, and you need somebody to help you out with the carrier maybe, and I'm around to help you with that. So my point of doing this is to get you to get to know me and me to get to know you, so you can feel that there's somebody out here that wants to help you to make the right decision and be there for you. So that's what I would say to you on if you're on Medicare insurance right now, is to do what Richard's going to do. Reach out to me and go to my website, www.martincowardinsurance.com, and you'll see a link that says take me to Martin's calendar, and you can sign up without even talking to me. Go right to my calendar and sign up for a free 20-minute interview with me, and we'll do a review like that. So that's my invitation to any of you who are currently on Medicare. Now, Lori, if you're going to be coming on Medicare in January, now is a good time to meet with me, and let's try to find a plan that you like in your area. What that looks like, we'll look at your current primary care physicians, any specialty doctors, any hospitals you like, and we'll look at all your prescription drug coverage, and we'll put that into the system, and we'll have a medical profile on you in your area, and we'll find all the plans and options available to you in your area. You don't have a Medicare number yet. You definitely need that Medicare number. And so that's the first thing you want to do, is you want to go to ssa.gov and apply for Medicare Part B effective January 1st. Okay, perfect. That's your appointment to go get your Medicare number. Perfect. That's absolutely perfect. So as soon as you get that number, then you can call me and I can help you find a plan in your area. And then we'll go from there. Does that help? But you're on the right track. You want to go to the Medicare, and you don't want to play for Part B until you need it. If you're working for another company or something, you may not, because you got to pay for it. Part A is free, but Part B will cost you a minimum of about $144 a month. But then you got to add the supplement to it. Let me just go over really quickly the idea of what the supplement's about and what the Medicare C is about, because I just want to make sure you understand something. Medicare A and B, original Medicare, basically just cover 80% of the cost of your hospital visits, your hospital visits, your doctor visits, and care like that, the actual health care. And they only cover 80% of it. You're responsible for the other 20%. Also, they don't cover prescription drug plans. So you've got two options. You've got option one, which is you can buy a supplement plan, which is $200-300 a month. It will cover everything. And you got to buy a drug coverage plan, which could cost you anywhere from, say, $20 to $50 a month. So that's going to cost you that. And it's good coverage. But the thing about it is, you don't always need that. You can go with a Medicare C plan, and as you saw from the slide, the video, and you can get a zero cost plan, and you'll get more benefits, and you just pay a little bit as you go. And there's a cap. And the cap is not a lot more than what you might pay in 1 year for the supplement plan. So it makes unless you're really sick and you got a lot of expenses, I really don't encourage people to take a supplement plan because it's just too darn expensive. And you don't need to, because you can get some really, really good plans and coverage in your area with all sorts of extra benefits under a Medicare Advantage plan, and it won't cost you as much money. And there are out-of-pocket maximums you can pay a year, so you're protected that way. So, and we'll go through all of those when we meet, when we look at your alternatives. We'll design one that meets whatever you're trying to accomplish. But I wanted to give you an overview as to why you need to buy something, because you don't want to be at risk for that 20%. Because if you went to the hospital for one visit, that could be that could be several hundred, that could be $100,000 for a major surgery, and you're going to be, if that's $100,000, you're going to be responsible for 20, and that's a lot of money. So, and you don't have to do that, because you could just buy a Medicare Advantage plan, and you pay nothing for it really. You can get them for zero cost, and you won't have to worry about that. It takes the risk off your plate, and you feel good about it. I mean, the plans today are fantastic. They got like plans that they include dental benefits, some hearing aid benefits, vision benefits, plus free gym membership, and all kinds of over the counter. There's just a lot. They've gotten competitive, and there's just a lot of extra things that you can get, and from being part of these plans. So and what I really want you to do is to find something that makes you feel good. You should feel good. These are great plans, and these are great coverage, and you pay for it all your life. You might as well have something that's really good for you. And that's my primary purpose, is to make sure not only do you get plans that are right, but you feel good about them, because you should feel good about them. Anybody got anything else that they want to add today to that? So Laurie's going to go in, and she's going to get her Medicare card on the 16th of November. And anybody else have any want to reach out to me and set up a time to get together? You can put it in the Q&A, or you can just simply speak up. I think all the okay. Anybody a veteran?
Oh, yeah.
Richard, you're a veteran?
Yes.
Were you speaking to me a while ago that was on disability? Or was that, I've got a Richard and a.
No, it was me.
Okay, so let me ask you this question: why aren't most of your drugs covered by the VA benefits?
That's a good question. I don't know.
Because if you're a veteran, you should be getting all your drugs should be covered by the VA.
I'll have to look into that. Thank you.
Yeah, do that. And I'll tell you, the reason why I asked that about veterans is this. Let's say you are a veteran and you can find, okay, Laura, I asked you a question 1 second. Let's just say you're a veteran and you call up and they say, yeah, you can get your VA card. You can start going to the VA hospital and the VA doctors, and you can get all your drugs covered by the VA. Would that be good for you? And certainly all your diabetes drugs, right?
Yes.
Okay. So one, I definitely reach out to the Veterans Administration and find out if you're eligible for VA benefits. That's the first thing I would do. But I got some good news for you. Most veterans aren't aware of this. Most Medicare Advantage carriers have plans specifically designed for veterans, which are zero cost, which will allow you to access networks. You said you like going to all these different, you may not want to be just restricted to VA doctors and VA hospitals.
Right.
So you can buy a zero cost Medicare Advantage plan, that will give you access to all the doctors and hospitals in your areas out beyond the VA, plus all the extra benefits such as dental, gym membership, et cetera, et cetera. And you get your drugs not from there, but you get your drugs from the VA. So there are a lot of different ways for us to structure a really good healthcare plan for you.
Okay, good. Thank you.
I'd call the VA and I'd ask that. And Lori said something about her husband Your husband's on a supplemental plan already. Um, what I would suggest, I mean, if he likes his plan, he doesn't. I was losing. Okay, let me see what this says here. My husband has a supplemental plan. We don't have for their plan in, and he has to pay 88 a month for his drug plan. So he's paying close to $200 a month for that. His work gives him back a little over 700 a month as long as he's on their plans. When you say their plans, do you mean he's on whose plan? He's on the company's plans or on the United Healthcare plan? I mean, I never heard, I don't know why. I'd have to, again, I'd have to really look at what his current situation is. Okay, so he's on a United Healthcare through his benefits package. Okay, well that is, it sounds like it sounds like a very good setup, particularly if he's getting over $700 a month as long as he's on their plans. I've not ever heard of that. Oh, a year he gets back 700 a year as long as he's on their plans. Well, he might want to have he also might want to have a conversation with me because it might be cheaper to go to a plan. If he likes it, wants to keep it, he doesn't mind paying 134.88. That's about 200 a month. It's 200 that's 1,200 a year minus the 700. That's about 500 a year he's paying for that plan. He could go to, if he likes it and wants to keep it, that's certainly an option. Plus, you're gonna always pay 144 for plan B no matter what. But I do think it might be worth his while to set up a time with me. I have no interest in trying to get somebody to move off of something they like, but it could make sense to just see what his options are. It's kind of hard for me to tell exactly what he's got right now, whether it makes sense to not, but I can at least show him what his options are to see if he wants to go to a plan C, and he might get more benefits and he might get at lower cost. I don't know. We'd have to take a look at it. But this is the thing. You don't go on his plan, by the way. I don't think you go on his plan. Usually Medicare plans are standalone. Reason why you can't talk to them is because it's you. Now, I don't, but every company has its own thing. When I turn 65, together our insurance will be over $700 a month, counting Medicare. It shouldn't be. That's the point. It should not be over $700 a month when you turn 65. It shouldn't be. I don't know what you got, but a supplemental plan, it should not cost you over $700 a month for the two of you. We can find you much better coverage than that, at a lot more coverage at less cost. But again, you've got this extra wrinkle in there about his current company and how they're covering things, and I don't really understand how that wrinkle works. So we'd be better off, instead of me trying to guess how it worked, is to actually sit down with the two of you and see what we could design that's going to give you everything you want at a lower cost. That's the best thing I can do, and I'm happy to do that for you. But y'all shouldn't be paying $700 a month for Medicare. You might be paying 144. I mean, if you were in a Medicare, let me just out there. Just
hook up with this guy on a one-on-one.
Yeah, I would do the same thing. Yeah, I would do that. But this is the deal.
With my things.
This is how that works. If you wanted to go to a Medicare Advantage plan, and there are zero cost plans and zero premium plans, $0 plans out there available, and you would pay, that will cover your drugs and everything else, and you just be paying the $144 a month that you got to pay to Medicare Part B. and that would be it. If you wanted it, then they're available. They're good plans. I currently have a plan with Aetna here in northern New Jersey. I love it. I pay $36 a month for it, and it covers everything I can possibly imagine. It even includes some dental stuff and that kind of thing. So there's a lot of things that you can do. I understand what you're saying. You're right. It does add up, but that's why I suggest that you meet with me and let's put the numbers together and let's see what we can come up with. And you might like paying that much money and getting what you're getting, and that's fine. But there might be options for you that will get you the coverage you need at a lot less cost. I'm sure there are, as a matter of fact. I know it's not an Advantage plan because it's a supplemental plan. Advantage plans are either zero cost or minimum cost premium plans. So they're very low plans and they're low cost. And that's what state do you live in? Laurie, what state are you in? Tennessee. Okay. All right. Again, the best thing to do is just schedule some time with me and let's see if we can find something for you that's less expensive or at least show you an alternative and we can go from there. But you got good questions and these are typical because people understand between Advantage versus supplement, and then you got to pay for the Part B, and then you got he's paying 144 plus 134 plus 88. That's $300. That's $700 a month. Y'all be paying for the two of you. That's a lot. That's $700 a month. That's a lot of money. See, I'm happy to find something better than that. Anybody else got any questions? Rick, you got any questions? Sandhya? Well, if you don't have any more questions for me, we'll close this out. You see my email address right there on the screen. Simplest thing to do if you want to schedule an appointment with me is just send me an email, and you don't have to wait. You don't have to wait until November 16th. You can't purchase anything from me. I mean, I can't enroll you into any kind of plans, but we can certainly do some research and help you find something so you know when November 16th comes around what's available for you. I can't really enroll you until you have a Medicare insurance number, and you're not going to get enrolled until January. You're not going to be in a plan until January 1st. But if it could put your mind at ease, knowing what your options are and what's available, certainly you can call me and we'll set up an appointment for this week or next week. That's fine with me too. Well, I don't know why they're telling you that. I don't know why they're telling you that. I mean, I can help people. I do it all the time. People waiting to get their car. I have friends that call me. They say, I'm going to be 65 this year. Can you help me find a plan? I'm like, sure. Let's find you one. I usually say, wait till you're eligible, but I can certainly help you find something now. I don't have to. Maybe they don't want to meet with you because they can't sell you anything because I can't sell you any product. And how I get paid is I get paid by the carriers, who ultimately get paid by Medicare. But I'm not concerned about that. I want to help you get the right plan. So you can call me. I'll be more than happy to talk to you before you get your card. See if I can help you find something. Be my pleasure. So anybody else? Rick Pearson and Sandhya Shah, do y'all have any questions for me? Do you need anything? Are you in an annual enrollment period, or what can I do to help you today? Okay, well, Lori and Richard, I look forward to hearing from the two of you. And Rick and Sandhya, if y'all decide you want to reach out to me, give me a call. I'm happy to schedule some time and do a one-on-one review of your Medicare insurance needs as well. I hope this was helpful to everyone today. It's been my pleasure to share some of my knowledge and wisdom with you, and I look forward to hopefully meeting with you sometime soon. And you'll get an email with an access to the replay in case you want to watch that as well. Okay. Thank you. Thank you. Let's see. Thank you. Maybe where's the Q&A? You're welcome. Thank you, Sandy. You're welcome. Oh, I see. Oh, I'm sorry. I didn't see this. So, Sonia, you'll turn 65 in February. So you got January. So you got November, January. Oh, so you're right now, November, you can go ahead, just like you got 3 months ahead of time. You can go ahead and get your Medicare card and get like Joni's doing. Go ahead and get your Medicare card now, and it'll be effective as of February the 1st. And again, you can call me anytime, and we can do some research and find what you want to do when you're eligible. You don't want to wait you don't wait to February. Go ahead and you can do it now, and you can actually apply as long as you got your Medicare number. You could apply with an effective date of February the 1st. So there's a lot of options for you, and I'd be happy to help you. You just have to send me an email, and we'll be able to do that. Sandhya, where are you located? Just curious. What state are you in? Good. I'm glad that was the purpose, to be informative and share some knowledge. Oh, you're in New Jersey. I am too. That's great. That's great plans. And you're lucky. There's some really, well, actually, everywhere I go, particularly in the major states, New Jersey, New York, California, Florida, there are some fantastic plans. And so I'd be more than happy to help you find something here in New Jersey. That's my neighborhood too. So reach out and give me a call. Okay. All righty. Well, thanks everybody for showing up today and being part of a wonderful audience. And I'm so glad I was here to help you. And I will see you soon, I hope. Have a great rest of your afternoon. Take care. Bye-bye.